All right, let's try this before Ann interrupts us again. All right, welcome everyone to the June installment of the Healthy Families Florida Speaker Series. I know you all have busy schedules, so I wanted to take a second to thank you for attending this session and showing interest in improving the services that we provide to fathers and families that Healthy Families serves. Hopefully, by the end of this presentation, you will feel like you have more knowledge about engaging fathers, identifying postpartum depression in the fathers and families you serve, and helping get fathers the resources they need to help them with this challenge. Next slide. All right, so the importance of fathers. Hopefully by now it's no secret how important fathers are. Children with involved fathers have a strong foundation for child well-being. When fathers are more involved with their children are at a lower risk of infant mortality, low birth weight, emotional and behavioral problems, neglect and abuse, injury, poor school performance, criminal activity, substance abuse, and suicide. And it's not just children who benefit from having an engaged father. Mothers who have children with involved fathers also experience a huge amount of benefits during pregnancy and when raising their children, including they are more likely to receive prenatal care, are less likely to smoke during pregnancy, experience healthier births, have more time for self-care, and have lower levels of parenting stress, lower risk of postpartum anxiety, and lower risk of postpartum depression. A father's engagement isn't just beneficial to their families. Father engagement also creates benefits for the dad himself. The more engaged a dad is, the more likely he is to have higher self-esteem, lower levels of depression, increased self-confidence, increased problem-solving skills, higher levels of health and life expectancy, increased social participation, and they possess a better ability to regulate their own emotions. So I know that a lot of you have gone through some of the other great trainings offered by the Healthy Families Florida Training Institute and probably already have a good idea of what postpartum depression is. But before we dive in, I wanted to give a quick description of just what exactly is postpartum depression. Postpartum depression is more than just the baby blues. Many parents experience a drop in mood and/or an increase in anxiety before or after the birth of their child. These blues should fade untreated and within a few days or a week after of the birth of a child. Postpartum depression can manifest itself as an intense feeling of sadness, anxiety, or despair that prevents the parents from being able to do their daily tasks, including giving the best care to children, their partners, and themselves. It can even lead to feelings of wanting to harm their children or themselves in extreme instances. Typically, postpartum depression can occur up to a year after having a baby, but typically begins to start around 1 to 3 weeks after the child is born. But symptoms can begin manifesting while a mom is still pregnant. So here is our sort of first difference between mothers with postpartum depression, fathers with postpartum depression. The highest levels of PPD in fathers occurs between 3 to 6 months after birth. This timeline is a little bit later than traditionally seen in mothers who develop postpartum depression. All right, so what causes postpartum depression in fathers? Before we start to take a closer look at what postpartum depression looks like for dads, how to identify it and how to help them and their families through it, let's watch a quick video where 3 men discuss their experiences with postpartum depression.
Oh, yeah. Right. I'm talking about consumption. I told him what I was supposed to experience. I was supposed to feel absolute love and adoration. I didn't feel those emotions. I didn't feel that connection to my started to instantly feel like a failure.
The idea that a dad could get pregnant with depression is kind of alien to me. Otherwise, going to be that pregnant with depression is something that's caused by hormones.
Women go through significant hormonal changes related to having a baby. However, if we think of having a baby as a life event, I think that's probably the most helpful way of looking at it. Now, life events, we know, can cause depression. And having a baby is probably one of the most stressful life events that anyone can have. So fathers can definitely experience the same sort of psychological and social factors that lead to postnatal depression in the same way that women can.
Men don't talk about their feelings. No, it's not a manly thing to do.
We get the whole man up
You
thing.
get the bravado, don't you? Yeah.
I couldn't sit down with 10 of my mates in the pub all that and banter with each other and go, can we get serious for a minute and talk mental health?
You just got to get on.
Yeah.
You have to have the strong upper lip and just, you know,
But
back on
it's-
the vibe.
My wife had postnatal depression with all three of our children, and I just wanted to be there to support her, to kind of be the rock that she could depend on. I think because I've been so sort of encompassed in making sure Sarah was okay, I hadn't paid myself much attention. I didn't seem to enjoy anything, didn't interact with people. Our eldest daughter had asked why Daddy was always grumpy all the time.
It's a difficult thing to put a finger on how it got so serious. I was getting told it's just baby blues, you're just a jealous dad. I started to think like that. I started to think that to me, there's something wrong with me. I just started feeling guilty more than anything. That guilt of I need to love this child. I know I should have these feelings, but I can't force them. One day I just decided that Elizabeth would be better off with a dad who's not here. I was getting to the point where I was considering taking my own life.
Feeling straight away like a failure, it made me feel like I couldn't do this. I wasn't ready. I would look at myself in the mirror, and the person I would see looking back at me wasn't me. It was someone different. It was kind of like a dull, grayed out version of myself. I had so much self-doubt about myself and my abilities as a parent. I felt like I was going to fail this little person.
I already knew how I was going to do it. Just set a train tracks close to where I lived. Well, I was just going to walk until the train hit me. I was unlucky at the time, I would say, but now I'd say I was lucky. There was an off-duty police officer who was walking alongside me for a little bit. Eventually got me to stop. He persuaded me to get back onto the platform. He didn't make me feel like it caused a problem. It just made me feel like I needed help. And I remember that day I tried to take my life. I'd seen the doctor. I got home and Elizabeth did something that she'd never done to me before, and she just reached out and sort of wanted me. Sorry. She grabbed me, put her arms around me, and knew I had to be better for her if no one else.
The challenge has always been that men don't come forward with their mental health difficulties in quite the same way that women do. The mental health of both parents is extremely important for the well-being of the developing baby. So it is really important that men don't suffer in silence.
It's definitely a very important thing for men to be better at, in my view, at talking about how they feel.
A dad can easily be going through something, and that dad should never feel that he can't talk to anyone about it.
I'll happily take that label of man who suffered with postnatal depression because it's about raising awareness now. If people can see that I can get it, then maybe more men come forward.
So yeah, I mean, I don't know what you guys are like, but I'm obsessed with Pepper Time.
Oh yeah.
It just amazes me how much I love the kids. I couldn't imagine life without them now.
Oh no. I don't understand how I could have been not getting that sense of amazement and enjoyment that you get now. It seems strange, but obviously it's not rational. You're not in control of it. It's something that's kind of got hold of you. I went to my GP, he gave me some medication, and then went on to have cognitive behavioural therapy. It allows me to, most of the time, be somewhere near back to how I used to be.
Sometimes it does creep up a little bit tougher than other times, but nowadays, thanks to talking about it and seeing a GP, I've been able to now at least keep it at bay.
I wouldn't change it for the world. I love every minute I have. with my kids.
Nowadays, I feel that sensation that I was meant to feel.
People, that's the best thing in my life, but without a doubt.
All those things that I wanted to do right at the beginning.
There is just the most unconditional love for these two little human beings.
I'm really happy that I've been able to come through the other side.
All right, let me get my video back on here. There we go.
Here you are, a new father.
Oh, goodness.
You were really excited about the pregnancy
Pause.
and even the birth of your child.
Get after it, bro. Okay. All right, so a lot of research suggests that 1 in 10 men may experience postpartum depression, but it is believed that the number could be even higher due to men often being less likely to share their feelings. The number may even be as high as 1 in 4 men may experience signs of depression after the birth of their child. Men can experience postpartum depression due to several changes that comes with the birth of their child, including both biological and environmental factors. The biological changes new fathers undergo are not as well understood as those that new moms experience. Scientists are just starting to find that both men and women undergo hormonal brain changes during their transition into a parent's life. In essence, being a dad is as biologically a phenomenon as being a mom. For example, studies show that men experience a drop in testosterone around the time of their children's birth. Another hormonal challenge men face is that their brains do not give them the same surge of oxytocin, which is associated with feeling good and bonding with the baby that moms get when giving birth and during breastfeeding. This sometimes means it can take a little extra time for men to grow their attachments with their new baby. Then there are environmental and lifestyle changes that dads face with the birth of a new child. A lot of new and soon-to-be fathers experience a huge amount of financial stress. They feel like they won't be able to meet the financial needs of their family and fail as a man. After a child's birth, men also experience a lack of sleep. And we all know everything gets a little harder when you aren't well rested. The birth of a new child can also create a lot of relationship stress. Maybe a couple don't see eye to eye on how a child's care should be divided, or they argue about how they want to raise a child, or maybe dad feels like he's not getting the same amount of attention from his partner that he did before. New dads also may not be able to spend as much time on hobbies or hanging out with friends like they used to. There are some risk factors that make a dad more likely to develop postpartum depression. If you know any dads on your caseload that have any of these risk factors, it could be a good idea to watch a little closer for them to develop postpartum depression. One of the biggest indicators a new dad may experience PPD is they have experienced other mental health problems in the past. If a man has a diagnosis for depression, anxiety, bipolar disorder, or any other mood disorder, is a huge indicator that he may develop some form of postpartum depression. And it's not just a father's mental health that can be indicative of an increased risk for PPD. The depression status of a father's partner also has an effect on them too. Partners had experienced an increase in depressive symptoms when their partners were also affected by postpartum depression symptoms. Another dad-specific risk factor is if he witnesses delivery complications, specifically life-threatening or those that result in poor outcomes, and especially if they haven't been informed on them or not aware that they could happen. This can be deeply traumatic for fathers. Having a new baby or knowing you're going to be having a new baby is stressful enough on its own. Another risk factor for developing PPD is having stressful life situations leading up to or around the same time as the birth of a child. Things like pregnancy complications that we just mentioned, illness, a death in the family, or a job loss can be a big indicator to look out for. Anything that can make a family feel less secure leading up to or shortly after the time of their child's birth can increase the risk. Finally, a dad engaging in risky behaviors could be an indicator and a symptom for an increased risk for PPD. So things like if a dad smokes cigarettes, drinks alcohol, smokes marijuana, or uses any other drugs, it can be a risk factor. If a family has a history of domestic violence, it can also drastically raise the chances of PPD. So again, if you know a father on your caseload who has any of these risk factors, make sure to take a little extra time to check in on his mental health during your home visits. All right, so how to recognize postpartum depression in dads you serve. All right, so we spent some time learning the effect postpartum depression on fathers and their families, and some of the risk factors that may increase the likelihood that an expecting new dad may experience postpartum depression. So now we're going to transition into the what can you do to help fathers with postpartum depression phase of the conversation. Dads and moms often exhibit a lot of the same symptoms of PPD, but it is important to know that dads may outwardly express these symptoms differently. Dads are more likely to acknowledge fatigue and irritability rather than emotions like sadness or depression even. They might display hostility or anger or use avoidant escapist activities like overworking, excessive TV time, or withdrawing socially. One of the most important things to help you recognize a father with PPD is to take the time to get to know the dads and the families that are on your caseload. You want to learn what the baseline behavior is for the dads you serve, so that if they experience a change in their physical or mental state, you will recognize that there is something going on. Then you can start to help correct the course. A great way to get to know the fathers that you serve is to involve them in all of the tools, activities, and curriculum that you can. This starts with the Healthy Families Florida Assessment Tool. It is the ultimate way to help begin to understand a father's situation. Most of the time, the HFAT is administered, we score FOB based on the responses of MOB. When it is possible, fathers should get a chance to give their own story. This may mean taking some extra time to schedule an assessment that dad can attend, or even conducting a separate second assessment at a time that the dad can participate. This is also a great way to start to identify risk factors for postpartum depression. The more you involve a dad in your home visits and outreach, the more you will develop a trusting relationship with that dad. One of the biggest barriers to identifying and treating fathers with PPD and serving dads in home visiting programs for that matter, is that lots of men do not feel comfortable being open about their feelings and perceived shortcomings. It can be very hard for men to feel vulnerable to others. And when do you feel more vulnerable than when you're feeling depressed or like you're failing your child? So how do you overcome that barrier? By developing trust. The more you show a father that you're coming from a judgment-free place and that your number one priority is the same as their number one priority, their child, they may begin to open up and share what they are struggling with. The trust you develop is going to end up being one of the most valuable tools in helping identify and treat fathers with postpartum depression. And so one of the most valuable resources in identifying if a father is suffering from PPD is to speak with their partner, who spends more time with the dad and knows his normal emotional and behavioral patterns more than his partner does. Make sure that during the home visits that occur prenatally or shortly after enrollment, that you take time to explain to participants what postpartum depression is, how it affects them, and how it affects their baby. If you can help them understand the risks and symptoms, they can look for those changes in their partner and reach out for help if they recognize. And this goes both ways. Dads can also help you recognize postpartum depression symptoms in the mothers of their children. All right, so Helping dads build tools to prevent and mitigate postpartum depression. So there's no guaranteed way to prevent postpartum depression in fathers. Even someone who practices all the prevention, preparation, and healthy habits we're about to discuss can still develop PPD, and that is okay. It is certainly not to be viewed as a failure on their part as a father or yours as a home visitor. What we hope to cover in this slide is how to help dads build a strong foundation of positive mental health and life choices leading up to the birth of their child. If they learn these skills and they do still develop PPD, they'll be much better equipped to process it. So we're going to run down the list here. Prevention method number 1, education. Helping dads to learn about postpartum depression. This will enable them to recognize the condition if it occurs in themselves or the mother of their child and get help more quickly. It will also allow them to advocate for themselves to any healthcare providers that they are seeing. Number 2, avoid major life changes around the time of the child's birth. So first, I understand this is a big if it can be avoided. Sometimes stuff happens, but if it can be avoided, don't make any big life changes or decisions during the pregnancy or around the time of the child's birth. A father keeping his life as simple and stress-free as possible around one of the already most stressful times in his life can help make postpartum recovery faster and easier. All right, 3, sleep and eat properly. It is no secret that a nutritious diet and the right amount of sleep can make all the difference to your physical and mental health. Help expecting fathers to develop proper eating and sleeping habits leading up to the birth of their child. And hopefully this can ease their transition into being a parent, because we all know their sleep pattern is going to be interrupted. Method 4, exercise. Help dads schedule a time each day to get some exercise. Even 15 minutes of time dedicated to walking around each day can elevate someone's mood, help them feel better about their body, and feel more in control of their situation. So sometimes people think that exercising is only running or lifting weights in the gym and stuff they just don't like to do. So help remind dads that exercise can be fun too, like things they enjoy. So playing a game of basketball with friends or going on a hike with their partner are great ways to get up and get moving. Method 5, communication, developing communication skills. Help dads practice and develop healthy communication skills. This will help them let others know how they are feeling and what their needs are. You can do a whole lot of this just by consistently normalizing communicating emotional needs during your home visits. Helping a father and mother develop positive communication about their child can also help lessen the anxiety around having a new child, as well as help build a strong support system for when challenges inevitably arise. Method 6, prepare for the childbirth. It is pretty universal that the more you are prepared, the less anxious you are. Make sure dad is included in creating the birthing plan and conversations about all the possible outcomes in the delivery room. This will decrease the likelihood of having a traumatic childbirth experience, or an unexpected one anyway, which can be a trigger for postpartum depression. A great way to help a father and family plan for the birth of the child is by making a family goal plan around creating and executing a birth plan. So method 7, building a support system. Help dads do this so they can have someone to lean on when they are feeling frustrated, overwhelmed, or just plain tired. Someone who they can vent to about how they're feeling and how their life is changing. This support system can also help dads recognize signs that they may be behaving differently and could be experiencing postpartum depression. This support could be people like a friend, another father, their family, a member of their church, a counselor, etc. If your site has a father-based circle of parents, this could be an excellent place to help dads connect and support each other. And if you don't have one of those and are interested in starting one, feel free to reach out to me. I would be glad to help you get one started. All right, so method 8, bonding before birth. One of the biggest ways dads are shown to overcome postpartum depression is by bonding with their child. Excuse me. As we at Healthy Families know, bonding can start even before the birth of their child. There are a ton of activities that encourage father-child bonding, including but not limited to things like going to prenatal doctor visits, taking care of mom, feeling the baby kick and move, talking, singing, reading to the baby, taking time to learn about the pregnancy and preparing for the birth. I found a great list of bonding activities that I'm going to put in the chat now. And this link had a bunch of really great stuff in it that you could pass along to dads. All right, so Healthy Families Florida already has one of the best available tools for screening for postpartum depression in men. And you all already trained in administering it. So it's the Edinburgh Postnatal Depression Scale. Most of you have already gone through the training that helps you administer and score the EPDS. So I'm just going to spend time focusing today on ways that you can optimize the way that you use the tool with dads on your caseload. We have already discussed making sure to include dads in your home visits with tools and curriculum. An important part of helping fathers feel comfortable discussing some of the sensitive issues that can be brought up during EPDS administration is to make a father aware of the tool before the visit the screen is administered. This can help normalize the screen and help the dad share what's really on their mind. So I am going to ask that you change the way you think about this tool. It shouldn't just be administered to moms. You should also administer the EPDS to dads at the same intervals that you give them to moms. This will make it easier to remember when it's time to use the tool. But keep in mind that you should always have an extra Edinburgh sheets in a family's folder so that you can administer one if you think it's necessary, like you show up and mom or dad is acting differently than normal. So while the Edinburgh is a good tool for screening dads, there are several studies that suggest the threshold score for a father to likely be suffering from a depressive illness is a little lower than the score for a mother. This is due to men often underscoring questions. Excuse me. One study even noted the likelihood of men to severely underscore questions 9 and 10. These questions focus around crying and self-harm. This is to believed to be true because men feel like expressing these emotions and feeling them makes them less of a man. The threshold HFF places on postpartum depression on the Edinburgh screen for moms is scoring a 13 or higher. So if a father's Edinburgh score is a 10, 11, or 12, it may be necessary to follow up with them anyway. So this is noted on the Edinburgh itself, but I think it's important and worth bringing up. Question 10 asks the dad if the thought of self-harming myself has occurred to me within the last 7 days. If a father self-reports that he has had suicidal ideations or thoughts of self-harm, you need to contact your supervisor immediately on the best course of action to follow up. All right, so supporting fathers with postpartum depression. All right, so you've gotten to know a dad on your caseload as you provide services to the family by involving him in the Healthy Families Florida assessment tool, activities, and our curriculum. You notice a change in his normal behavior and start to recognize some of the symptoms of postpartum depression that were mentioned earlier in this presentation. Maybe mom even mentions in passing that he just hasn't been himself lately. So you've done a great job explaining and normalizing postpartum depression to dad. The Edinburgh has been mentioned to him previously, and in keeping in mind, he might not even realize the changes are taking place. You ask him if he'd like to take the screen. So Having a set of site-wide procedures that help guide workers on how to assist fathers who screen positive for postpartum depression. You do not want to have a dad who needs your help and not already have a plan in place as to what you can do to help. Having a site-wide procedure can help guide you to make sure you are providing the best support you can. It is especially important to know exactly what the protocols are when a dad scores on question 13, the self-harm question. One of the most important things you can do for a father who's experiencing postpartum depression is to make the proper referral to a mental health care provider who can help start care. This care may include things like medication and or therapy, and is absolutely essential to the treatment of postpartum depression. Every Healthy Families Florida team member should know what the proper referrals are to make at their site. So remember all the prevention tips from the previous slide that were designed to help dads build mental health resilience. So all of these strategies should continue to be employed if a dad has postpartum depression. Continue to encourage that father to get sleep when they can, obviously, eat well, exercise, and communicate with their support system. Another one of the best things you can do is to help dads connect with other dads. This will help them understand that they are not the only ones who have gone through what they're going through, as well as just having other dads to talk to about the joys and challenges of being a father. There are a couple of ways you can help facilitate these types of connections. Your site can host a fatherhood circle of parents group. You can refer dads to other active fathering groups in your area if your site doesn't have one, or you can let them know about some of the great resources on Postpartum Support International website, which I will also post in chat. This website has a ton of father-specific information, as well as support lines that are just for dads and virtual support groups that are just for dads. Those occur on the first and third Friday of every month. And everyone's accustomed to virtual meetings now, so hopefully that wouldn't be too big of an ask from our dads. I highly recommend you all check the site out. There is so much great information and support there. All right, so there is a scientifically shown correlation between the amount of time a father spends with his child and his mental health. So the stronger the bond between a dad and his child, the better for both of them. Use areas of parenting that fathers excel in to help encourage these bonds. So some things that dads are great at are playing with their children, helping them learn language, and challenging their children to overcome barriers. So one way that you can do this is by making sure to involve dad with administration of the ages and stages questionnaires. This is a great opportunity to empower a father to help his child develop, as well as have a little fun while they do it. Each home visit, you can give dad a couple of suggested activities that focus on one of the developmental domains in the ages and stages questionnaire. Explain to them why that domain is important and how these activities will help their child. By helping facilitate this positive parent-child interaction, you are helping the child developmentally, showing dad how he can play a role in helping their child develop, and helping improve dad's mental health by strengthening this bond with his baby. All right, so in summation, I know I said a lot today, so I feel like I've covered a lot. So I just wanted to take a quick second at the end here to highlight some of the actionable steps that you can take to help fathers with postpartum depression before I take some questions. Develop a plan at your site on how you want to address fathers and postpartum depression. Build a relationship with fathers and the families you serve by involving them in our program. This starts with making sure a father participates in the assessment. So include dads with home visits, curriculums, tools, and activities. Educate dads about important things like what to expect during pregnancy, at the birth of the child development, and how to build up his own mental health. Remember to use father-specific curriculum from the National Fatherhood Initiative Fathering in 15 website. You all have access to this web-based resource for free. Access is provided by the central office. Feel free to reach out to me and I'll be glad to get that website to you. Connect dads to resources, including mental health care referrals and father parenting groups. Administer the Edinburgh to dads at the same intervals as mom. And lastly, listen to and respect dads. Continue to provide the incredible support you offer to all of the families in Healthy Families Florida. All right, so thank you all again for attending. And if you have any questions, feel free to reach out to me. I will put my email address in the chat. Thank you all so much, and I hope you have a great rest of your day.